Today we're going to be talking about administering injections. Okay, so first you always want to verify the order. You want to confirm the provider's medication order. You want to use at least 2 patient identifiers, which is a name and a date of birth. You want to always ask for any known allergies, and then you want to explain the procedure and obtain a consent to continue. Okay, so going back to asking about the allergies, I also asked if they have any medication that they're taking. Okay, so you want to follow the medication right. So you want to make sure you have the right patient. You always want to have the right medication, the right dose. You want to know the right route, whether it's oral or intravenous. You want to have the right time, which is the morning or night. You know, you want to have the right documentation, right reasoning, and the right response. So check for like if they're having any kind of response to the medication. Okay, you want to perform hand hygiene. You always want to wash your hand, or you can use an alcohol-based hand sanitizer, and you want to don your gloves. You don't want any medication getting in your hands, or if you have any like cuts or anything in your hands, you don't want medication to disturb it or like get in it. You always want to wear gloves. Okay, so let's go on to the next one. Let's see. Okay, so number 4, the medication. Prepare the medication. You want to inspect the medication. You want to make sure the date is not expired. You want to make sure there's no discolorations. You want to draw up the medication using the sterile technique, which means you want to use a draw up needle, then you want to switch it out to the needle that you're going to be injecting the patient with. You want to label the syringe. Just in case you have multiple syringes, you don't want to get them mixed up. You want to prepare the injection site. So you want to position the patient comfortably. You want to identify the correct anatomical site for the prescribed route, whether it's subcutaneous or intramuscular. You want to identify your site. You want to clean the skin with the alcohol swab and allow it to dry. Do not blow it and do not fan it, because you don't want germs and air and particles in the sky to get on the site. Okay, so you want to administer the injection. So intramuscular will be medication delivered into the muscle tissue. Subcutaneous will be medication delivered directly into the fatty tissue beneath the skin. And then you have intradermal, which is medication that is placed just beneath the skin. So that is used for TB and allergy tests. Okay, and then after the injections, you want to activate the safety needle immediately. And then you want to, and never recap a needle. Activate the safety needle, and then you want to dispose it into a Sharps hazard container. And then you want to observe the patient for adverse reactions. Ask them how they feel, and then document the medication, right dose, right site, right time. And then back to the right time part. So yes, you have morning and night, but you also have medicine delivered with throughout the day. So you want to make sure you have the correct time in general. Important safety reminders: always use aseptics techniques. Never administer a medication you haven't been trained on or authorized to do so. Always follow your facility policies and be prepared to recognize allergic reactions and adverse reactions. Thank you for your attention to this video.